Namaste, I'm Dr. Rohit Madhurkar. Fibroadenoma is a non-cancerous breast lump. That means it's a lump in the breast or a mass in the breast which will not spread and go to different parts of the body like a cancer. This fibroadenoma incidence is around 40%, and in India it is way higher than the other countries. When we compare all the breast cancers, fibroadenoma actually is commonly seen in the age of around 25, that is in young women, and it accounts to almost 60% of the lesions which are seen. So there's a lot of importance of fibroadenoma in our country, where the incidence is very high when compared to women in the other country. Coming to the main discussion of treating this fibroadenoma and how do we do it without surgery, and we are going to make it scarless. There are two main forms of treatment currently approved for fibroadenoma of the breast. One is VAB, vacuum assisted biopsy, where the piece of the fibroadenoma is cut and it comes out one by one through a big needle which goes in and takes the tissue and it throws out the fibroadenoma. It is like carving it out and pushing it out. So it's called vacuum assisted biopsy because it carves it with vacuum, it sucks it out and it comes into a container. The whole fibroadenoma tissue comes into a container outside. This pulls out this thing. What I want to emphasize, or what even more advanced way of treating fibroadenomas, is cryoablation. Cryoablation is a simple technology which is also done purely under local anesthesia. You have to just lie down, relax. We'll give you a local anesthesia, like how you might have got an FNA or a biopsy done, which will not feel, or like drawing a blood. So once that anesthesia is given, you will not feel anything in that part of the breast. Then we put in a small needle which is called a cryo probe into the fibroadenoma. Now we have the fibroadenoma here, the cryo probe goes in, and we have a cryo generator outside which will start generating ice ball, meaning it will start forming ice in the tip of the probe, and this whole fibroadenoma will be covered by an ice ball. Once it is covered in the ice ball, the cells which are there within the fibroadenoma get destroyed and they die. They don't have the capacity to regrow again. They don't have a capacity to spread or show any further changes. It becomes a dead tissue, and slowly over a period of time, it is not plucked out like in VAB, but here the nodule is there. After the procedure, it is dead. In couple of months of time, slowly it'll reduce in size. When fibroadenomas are usually smaller in size, over a period of time they become non-palpable. You may not be able to feel it. It all depends on woman to woman, from breast to breast, and size of the fibroadenoma. So cryoablation holds a lot of advantages, is going to be the future of fibroadenoma, and many women who keep feeling the lump in the breast and always are worried and getting it checked yearly, they have a very good advantage of this advanced technology, cryoablation. Once we do it, we do follow up every 6 months for 1 to 2 years, and then once the nodule shrinks off, we don't have to follow up. Now you may want to know, like, what size of fibroadenoma, what is the fibroadenoma size that we can do cryoablation. So the intervention radiologist, when I am seeing the fibroadenoma, I'll understand whether the ball, the ice ball which I'm going to form while doing, will it cover the fibroadenoma. So less than 2 centimeters to 100% is the number. 100% is going to give you great benefits. But if the size is bigger, the fibroadenoma size is bigger, we may do 1 or 2 zones of ablation, cryoablations. Up to 4 centimeters, it can be done very well. But I'm sure women, when they come with the fibroadenoma, usually they are not so huge, like 4, 5, 6 centimeters. They're not of those big size. They're usually identified in early in life, and when they're smaller in size. So early diagnosis, early treatment is complete cure almost. So we have to aim on that and think what's the best technology, without surgery, without scar, without causing any destruction of the breast contour. We can get into the tissue and destroy that with a needle, and that's cryoablation. As I mentioned, it is done under local anesthesia. There will be a bandage in that area which you can remove it after 4 to 6 hours. There is no such tedious recovery where you have to do bed rest or be at home or do something. You can get back to your routine life. if not the same day, the next day after the procedure. It is not something which you are going to feel pain when you are moving around or discomfort, or which is going to disturb your daily routine. You will recover very quick, and this is the advantage of cryoablation.